Surgical site infections continue to be a significant concern in veterinary medicine, particularly following complex orthopedic procedures like the tibial plateau leveling osteotomy, often abbreviated as TPLO. Today, we're diving into a recent study published in Veterinary Surgery that investigates a potential method to reduce these infections: the use of antiseptic lavage during the surgery.
That's right. The tibial plateau leveling osteotomy is a very common surgical procedure used to treat cranial cruciate ligament disease in dogs. While it's generally successful, it does carry a higher risk of surgical site infections compared to other clean surgical procedures. The incidence of these infections after tibial plateau leveling osteotomy has been reported to range from less than 1% to nearly 16%.
And these infections aren't just a minor setback. While superficial surgical site infections might respond to antibiotic treatment, deep surgical site infections, especially those near implants, often require the removal of the implant to resolve because bacteria can form biofilms. Beyond the health impact on the dog, treating these infections also comes with a substantial financial cost. A study from 2014 estimated the average cost of treating a tibial plateau leveling osteotomy surgical site infection was over $1,500, and the annual cost across the United States was between $9.6 and $15.9 million.
Because of these risks and costs, veterinary surgeons have explored various strategies to reduce infection rates. Routine prophylactic antibiotics administered after the surgery have been a topic of discussion. Some studies suggest they decrease the incidence of surgical site infection after tibial plateau leveling osteotomy, while others disagree. There's also concern about how using prophylactic antibiotics impacts the development of bacterial resistance.
To find alternative non-antibiotic approaches, researchers have looked to human medicine. In human patients at risk for implant infections, an antiseptic lavage solution was developed. This solution contains ingredients like acetic acid, ethanol, sodium acetate, benzalkonium chloride, and water. It's designed for local application after implants are placed but before the surgical site is closed. This particular antiseptic lavage is reported to be compatible with orthopedic implants, effective against biofilms and resistant bacteria, and capable of reducing the local bioburden. Clinical trials in human patients undergoing revision total knee arthroplasty showed a significant decrease in bacteria and a reduction in postoperative periprosthetic infection rates. A version of this human product was adapted for veterinary medicine in 2019.
So, the objective of the study we're discussing today was to determine if using this pre-closure antiseptic lavage during tibial plateau leveling osteotomy surgery in dogs would decrease the overall incidence of surgical site infections